All right, I'll call the Board of Health meeting for March 17, 2020 to order. First thing I'd like to read a notice that we put on social media this past weekend regarding closures. With an abundance of caution and recent directives from the state DPH effective immediately, all of the following areas are closed until further notice. The town playground, currently under construction, the track and stadium, the basketball courts and the tennis courts at the Carver Middle High School, basketball court and the playgrounds at Carver Elementary School, and the playground at Bates Pond. Some useful information that came our way today. Try not to use public facilities like playground structures, as coronavirus can live on plastic and metal for up to 3 days, and these structures aren't getting regularly cleaned. Try not to have physical contact with people outside of your family. The state DPH has now restricted gatherings to no more than 25. This was from Carver Board of Health. So, we have no public hearings tonight. We do have an agenda, but I think we'll kind of move around and take number 7 there, the update on the coronavirus situation. Kevin?
Okay. Well, there's a lot going on and it changes daily. But what I can tell you is that there was a meeting held yesterday at 3 o'clock with all public safety personnel. During that time, we discussed things such as the cleaning schedule within the public buildings. The schools have been thoroughly sanitized and cleaned. They will continue to just maintain that level of cleanliness. They're not scheduled to come back until, I believe, April 7th. And so now, and also within the town hall throughout the week and weekend have been thoroughly sanitized and cleaned. In a meeting today, which was held with all the department heads and town administrator, there was discussion as to how the town hall is going to move forward in their operational procedures. Nothing is set in stone right now, but there will be a form of communication through the assistant town administrator, posting online the hours of operation within the town hall and how those operations are going to take place. The gist of it is that it appears as if the town hall is going to be continued to be closed to the public. However, they're going to try to continue to conduct as much business as they can, and most of that is going to be taking place within the foyer area of the town hall. Okay. Again, a lot of this is evolving pretty much as we speak, and I can keep you updated as that comes to light. That being said, I took part in a call-in with DPH. They hold a weekly call-in Tuesdays at 3 o'clock. So as a result of today's call-in, there are a few things that I can mention. There are 197 positive cases now in Massachusetts. Mm-hmm. And a large percentage of those cases revolve around the biogenics convention that they had. They are talking about more testing coming on board in the coming days. They believe that they'll be able to do upwards of 200 tests per day at the state labs. Currently, they only have the capabilities of doing about 200. The CDC guidance establishes new release requirements. In other words, if you're self quarantined, they weren't very clear, but it seemed to me that if you were asymptomatic for a period of 3 days, and you had been without symptoms for that period of time, that you would be able to be released at that point. Those are numbers, again, that are evolving, and as they become more focused and crystallized, I'll let you know, and I'll be posting that on the website as well. The part of this discussion today was, again, to reinforce social distancing. They mentioned, obviously, the closing of schools. At the beginning of this is how things are changing. At the beginning of the call-in, the number was no greater than 25 people in a gathering. That was reduced down to 10. And that was in the course of an hour of this call-in period. Let's see.
So is that the standard now? No more than 10?
No more than 10.
No more than 10.
Is a new standard. They are continuing to suggest that someone that feels as if they have some of those symptoms associated with the coronavirus, that they should, in essence, ride out the virus at home unless their symptoms become much worse. And at that point, they're encouraging, in severe cases, to just call 911 and be transported to a hospital. They are aware of the issue regarding supplies, and they're working on, through different channels, to get more supplies in the pipeline, so to speak. But they are suggesting that your first thrust toward getting supplies, if you're low, is to work through mutual aid channels first. So, you know, if I'm approached and there's a need for more supplies in one particular area or another, then I can reach out to area boards of health and through the emergency preparedness program to try to get or ask for any additional, if people have a stockpile of these, whatever the supply that, say, we're running low on, it's basically a sharing system, and it's worked in the past. But they are continuing to work with manufacturers and those types of, excuse me, and other organizations to try to make these products more readily available. Let's see, and that was basically it. There were a couple of questions that came in, but that was the basis of the call-in period. Now, as far as the coronavirus and other news, there are a lot of very good publications that are available through DPH and CDC. And what we've done and will continue to do is that anything that comes in that we feel is going to be new news and something that will be helpful to the general public is to just generally put that right on our website. But right now, our website does have a link to the Department of Public Health outreach, and it's very good. They basically change that daily.
Yeah.
And they keep everything updated. So you can go on there and look at, you know, things like the number of cases that are currently in Massachusetts, how many are confirmed, how many are presumptive cases. So that's something that should be viewed for anybody that's interested in looking at any news and any changes in policies that are coming up. But as everybody knows, it's just something that's very dynamic, something that's changing constantly. So that's, you know, that's where that is. As of, for instance, one of the publications, they have a section for confirmed cases, and this is something that's on that link. So they list each county, how many confirmed cases are within that county, the sex of the person, and then the exposure. So in this case, they list as exposure items, biogen, local transmission, travel-related, or under investigation. They list whether or not the patient has been hospitalized. So it's something to just keep an eye on. Hopefully the numbers don't grow. But from all accounts and from everything that's being written and said, the emphasis is really the social distancing. So that if you can limit, as they've mandated, limit the gathering of large numbers of people, make people kind of like just pound into people's heads, so to speak, that you need to continue to maintain that 6-foot distance and things like that, that it's going to work toward flattening that curve, because right now that trend is upwards. The more you can flatten it, the more you get a handle on things, and no one really knows whether or not the change in temperature is going to have an impact like it has on other flus that are out there. Nobody really knows at this point. But it seems to me from discussion that I heard today and from things that are being put out there as far as what other towns are doing, that it's going to be with us for, a good 3 weeks and probably more than that. Other than that, again, it's just ongoing. I think that the town is on a par with a lot of what the area towns are doing. It's very, very similar. Everybody's basically doing the same things that we are, and we're doing the same things that they are. And a lot of it is focused, quite honestly, again, back to that social distancing and limiting the numbers of people that can ultimately spread the disease because a lot of people don't know that they're even infected, and therefore, you just don't know. So I don't know if you guys feel that there's anything else that we should be doing, which is why we're determined to hold this meeting anyway, even though most town boards are not meeting. I think it's important that we all get together and have this discussion. So I'm open to any suggestions that you may have, but I don't know what else can be done that's not been done already. Things in the town hall are going to change as far as I said, as far as hours and not allowing the public free access within the town. But that's a changing situation, and it's being worked on, and it's a lot of what was done within the last 2 days.
I just had a question for you. Do we have enough supply on hand to last us, say, through June? And do we anticipate any concern with reorder of the supplies that are used to clean? From what I understand, the O&M does have enough supplies, I'm sure, till June. Okay.
Let me just provide a little clarity on that, is that they have taken an inventory of their supplies. With some of the discussions that have happened with Kevin and the rest of the department heads and the chiefs, through some of the actions that we're looking to take tonight with the Board of Selectmen, is that by limiting access to the facility, it will allow them to strategically make sure that those funds, those supplies, are used where appropriate. There are some supplies we're running low on. There's some that we've been able to order. There's some that are on back order. It is a problem. We don't have 6 months of supplies, but it's something that is fully inventoried and is being addressed. And I think one of the things that, as Kevin was going through the whole analysis of what's happening, is what we're going to be asking the Board of Selectmen to support tonight is limiting the access of all public buildings to the public. Is that This will allow essential staff that are necessary to maintain public safety and to maintain essential services so that the facility can be sanitized and cleaned for them appropriately. And we're trying to push all matters having to do with town operations to the website where the extent possible and avoid human-to-human contact and avoid the public coming into town hall. So that, again, going back to your question on supplies, is that priorities can be put where they need to be put.
Okay.
And make sure that those last until we figure out how long this state of emergency is going to last, and whether it's 3 weeks or whether it's longer. We're currently working through our latest department meeting is we're planning to at least make sure we're operational in a reduced state through the end of April. If it happens that things get released and the governor lifts his emergency order before then, great. If not, just because how things have evolved in the last week or two, we're looking longer than what some of these 2 or 3 weeks are, hoping for the best that it doesn't last that long, but preparing for a longer time frame and potentially even longer.
Okay, thanks.
You know, and I guess to go into a little detail, if I could, Kevin, just to kind of talk about our meetings, to provide a little more clarity there, is that what we're looking to do is, again, our main focus is protecting the health and welfare of the staff that are here to do the essential functions, public safety, to making sure that the public safety can continue to do their job, because they're going to be the cornerstone of what happens, and that includes the Board of Health agent, that includes police, fire, EMS, and operation and maintenance as well with the DPW. And that becomes our first priority, you know, after people's safety, is to make sure those are functional. After that comes operational issues, such as making sure payroll's done, making sure that there's funds available to buy new supplies and to order new supplies. Some may be done on COD. It all depends on where we're getting them. And then from there, any of the other components, you know, come into the lowest priority of trying to continue those services. So where the Board of Health issued the statement the other day that, you know, through the governor's office, that there'll be no activities outside in playgrounds, you know, and so forth, is that, you know, we're hoping to get your support too, that, you know, this should continue through town buildings. So the schedule that we're proposing is that Town Hall will be open to the public from 8 a.m. to 7 p.m. on Tuesday. We're looking to keep it open to the public 1 day a week. Now, when I say open to the public, we will take public inquiries. We're going to focus on the lobby of Town Hall for people to, you know, create a line outside. You got to keep your 6 feet between each individual, but to then have, you know, 1 or 2 representatives in the lobby to identify and address anything that hasn't occurred via electronic means, where they need face-to-face contact or they have to drop off a document. Now, that could run the gamut, and we've talked to all departments, of someone getting a death certificate for the board from the town clerk's office, or birth certificate. Again, they're going to try to do those remotely. There may be a need where they need a wet signature for a certain document, and they actually have to come in. The town clerk has stated she may go outside to meet people, again, trying to keep the separation that we can to maintain the facilities. From there, going down to the planning and permitting office, which could be somebody coming in to get a building permit, so that they can replace their boiler that's gone and they need heat in the house. That, you know, again, we'll have that activity available. From the finance office, making sure people can come in and pay their excise tax. We're going to be in a position where we're not going to accept cash. Again, moving forward, so this will be another strategic decision that the finance department has stated, is that until this is lifted, we will not be accepting cash. You know, again, that's a tender that's passed around to everybody, and again, we're trying to protect everybody in this process. And we're not going to, at this point, be selling dump stickers for the next few weeks. We don't feel that as we've looked at everything and talked about with all the department heads and the chief, in essence, we're triaging all of the issues. And of that triage is what's a priority. Well, right now, right or wrong, we all know that anyone can drive to the to the facility right in Rochester, and no one ever checks a sticker. So, why should we be putting employees in harm's way, and hopefully, and trying to not spread this virus by having somebody come in and need a sticker that they can just go to the Rochester facility without having a sticker. So again, these are the types of decisions and analysis that, we have all department heads trying to take a look at. It's an evolving process. We're not going to make all the right decisions. We're not perfect. We're just dealing with this on a daily basis, an hourly basis, based upon what the newest information is. We had a department emergency response meeting yesterday that included all the chiefs and the chairman of the Board of Selectmen. And at that point, we were told, groups no more than 25. Last night it changed to 10. What's it going to change to tomorrow? We don't know. So we are going to try to keep essential functions open in the town. We are going to have staff in the town. We're going to try to limit staff so they all follow the 6-foot rule. If obviously anyone's ill or appears to be ill, we're going to, make sure that person is not in a point to make anyone else pass anything around. From a functions of the town right now, as we know, the school's closed down for 3 weeks. All the buildings are going to be closed. We are continuing the Council on Aging Meals on Wheels, so those meals are being made. About 40 meals are being delivered on a daily basis, Monday through Friday, with more meals on Friday for the weekend. We are continuing the Gatcher bus program that's now focused solely on medical appointments and one scheduled trip to Shaw's in Carver each week. Again, trying to keep that population from being in close contact with one another, but the Gatcher bus service may be the only means that they have to get to the grocery store and to a doctor, and we have to be aware of that. I know I'm going over a whole bunch of things in probably no particular order, but that's kind of where all of the department heads, the public safety officials in the town, and giving the current directives or guidance that we're getting from the state, this seems to be the best solution we have for right now. And again, it may change tomorrow. And, from what I said, I'd love to answer any questions or comments, and I'm sure Kevin would too, because, we want the Board of Health to be behind this initiative. We're finding out that the Board of Health has, under a state of emergency, this done, and with some pending legislation the governor's going to follow, you're going to have even more authority. And your job is to look out for the health and welfare of the community, and we're just trying to merge that all together. One other point I will make is that we are going to try to consolidate communication down with the town and have a daily news release done that Elaine Weston will be overseeing, so that we can have one source of going out. Again, depending upon what network you talk to, what pace on Facebook you talk to, you got all different views on whether this is real, not real, whatever it is. We're treating it as real. The president's treating it as real. The governor's treating it as real. You guys are treating it as real. We have to treat it as real until told otherwise. And so that central point of communication will hopefully add some more transparency to this, and we can all get behind those updates.
Questions?
Not at the moment, no. Good, thank you.
Thank you.
You're welcome. Since you have no questions, I'm just going to talk about a couple other things. Is that we are going to discuss tonight at the Selectmen's meeting postponing town meeting, which was scheduled for April 17th, and then the possibility of extending the town elections that were on April 25th. Again, we don't know when those are going to be held at. We're not making the final decision to cancel them, but we're just beginning the preparation that it's most likely that we're not going to be able to have. I think last year town meeting we had 300 people. Well, obviously we exceeded that, with the rules that are out there right now, and I guess we're not seeing anything in the foreseeable future that's going to raise that up to 300 just yet. Tom will also be at the meeting tonight, just to reassure people that, as far as our public safety, police, fire, and EMS, is that, everything is functioning as usual. They're dealing with all appropriate emergency responses. They've got their appropriate gear as to what they need to do to deal with potential people that have symptoms. And they're continuing to provide those services. They do have enough supplies to continue for the foreseeable future. Again, depending upon what curve you look at, if we spike up, at some point they will run out if there's not more produced and not more distributed. But for the foreseeable future, we're okay.
Yeah.
I actually did have a question. The consolidated communication from the Assistant Town Administrator, will that go out through our webpage or through another means or multiple?
I think we're looking for multiple sources. Again, I can't say everything's been fully defined. I would say at a minimum, it's going to be on the town webpage, probably on the first page where you can just turn on town@carver.gov and it'll be there. From there, we will try to push that information out through Facebook.
And Carver Helping Carver.
Carver Helping Carver. All the Carver different pages will try to push that information. Art, you're a prolific user of Facebook, and when you see it, just keep on pushing it out too. But we want to push the same information.
Yep.
That's what we're just trying to do, is we all agree Kevin's part of what's written into that document. We just want to push the same document so everybody's aware of it at the same time where possible.
Yep. No, I appreciate that for residents to have a central, consistent source of information.
Yeah.
I also appreciate all the work that went into developing the triage and figuring out the system for now, however long the now is. Recognizing that there's a lot of changes happening.
No, thank you. I mean, and the chairman and I had a long conversation on Sunday, and what we were seeing was, a handful or two of towns had committed to close on Monday. Many of them were going to open on Monday to figure out what to do, and then thinking they were going to close on Tuesday. And because of all the changing information, we decided it was better to close the town facilities down on Monday and Tuesday completely, but for essential staff. Yesterday was public safety chiefs, today was all department heads, so we could come up with a plan. And, this is kind of where we're at this point. There will be times where, we are going to encourage employees to work from home, where we have the means to do that. At the same time, we are going to encourage employees to come in for a couple days a week, too, to do work here, because there still is office work that needs to be done. And that'll depend upon a case-by-case situation and a department-by-department situation, and the department heads will, in essence, kind of monitor what they need to do for their staff.
So tomorrow's thrust, so to speak, within each department is to try to figure out what is essential to get done, how much can get done in a couple of days that they'll be here. Again, there's an encouragement to do it remotely if you can. So tomorrow is really trying to bring a little bit more focus into where we're going. We have kind of a general idea as to what we want to do, but each department has to satisfy their own needs and duties. So that's going to take up the lion's share of tomorrow, just pulling all that stuff together. And I don't think the public will still not be allowed in town hall. And it won't be until next Tuesday that we actually restart the permitting process. As far as applications and dropping off plans and dropping off requests, whatever they may be. So we've got a little bit of time ahead of us. One thing that I should mention is that if the lobby is going to be kind of like the central point where all of this is going to be taking place, whether it be for permitting or finance or what have you, I had made a suggestion that we have a service door only for the employees. Yep. So they would be entering in the side door as opposed to the front door. They have that ability now because there are a full set of key cards that are going to be distributed tomorrow. So there wouldn't be any interaction between the public trying to get in and the town hall employees trying to get by them.
Yep.
Again, the focus continues to be, and it's going to be for quite some time, just distancing people. So,
Yeah, that separation is really important. And it's also, we go back to the supply question, is that it allows our custodial cleaning staff to better maintain the facility, and where they can sterilize, areas that need to be more attentive than others. If we had it just open to the public, then you're in full sterilization of certain areas that you may not need to be doing, that we're trying to do. I do want to point out one thing is that although we have everything set up so that we're going to have public interaction in the foyer starting next Tuesday is what our plan is, should there be an emergency that somebody needs something that's critical to something, and again, I don't know what those somethings are, but, all department heads will still have full access to their email, and they should contact the appropriate department directly via email, and identify what their issue is, and have a discussion with that department and see if something can be done sooner. So we are going to make sure that occurs. I'm not necessarily sure we want to encourage people using the phones all the time, because we're not sure what the staffing level is going to be at certain days, and if people feel they've left a message and there's 42 messages on somebody's phone line, I don't know if we can hold 42 messages, but let's assume we could, is that, they may not get back to them in an appropriate time, whereas emails, are more readily accessible to everybody, that people have access to. If there's a phone message on the voicemail here at Town Hall, employees may not be able to retrieve those from home, but they can retrieve their email.
Just really appreciate the thought that, has gone into all of this, and to keep people safe, and change is necessary.
Absolutely. Flying by the seat of your pants.
basically.
Well, we're dealing with the new reality. We talked about that after 9/11, the new reality, and now we're dealing with the, COVID-19 new reality that hopefully doesn't have a long life, but for right now, it is a new reality. And Barry, thank you for recognizing that, all the staff and the department heads have been strategizing together as to what the most holistic solution is to again, meet the priorities of protecting the staff and the public, but also providing public safety needs and other essential governmental needs. And that's what we've tried to do.
Welcome.
Okay. All right.
So, Kevin, I don't know if from what you're hearing tonight, does everything like that seem in line with what the Board of Health would be looking to do? Because, I'm going to ask Kevin to come to the Board of Health meeting, to the Select Board meeting tonight as well. I've got Tom Walsh coming as well, and just, I think it'd be good to have Kevin be able to share, the reaction or the feedback or, the support from the Board of Health in this time of crisis.
From everything I've seen, you're taking the steps you need to take to keep people separated and still be able to have the town function. That's an important thing. We have to function. We can't just shut down altogether.
Mm-hmm.
We have to make sure our staff is safe.
Yeah.
So I don't know what else, like Kevin said, I don't know what else you could be doing at this point. Okay. Next up on our agenda is an update on the violation complaint at 26 Montello Street.
Okay, so as you know, at the last meeting, I presented a letter that I had submitted to the owner of 26 Montello Street, just as a reminder. That was a complaint that came in from a neighbor, and based on the photos that were presented with the complaint, there were a number of violations that needed to be taken care of. Toward that end, the owner of the property instructed the tenants to work toward addressing the issues that I brought up in the letter. And I visited the site with one of our officers and found that they had done a significant amount of cleanup. There is a fair amount of it's an accumulation of a lot of things, but by and large, they are just pieces, you know, he's got a cache of tile that he's going to be putting up in his bathroom. He's got wood that he doesn't want to get rid of. I mean, there's a lot of stuff around, but my point is that what is there is not a health hazard. What was of concern, again, by the photos that were presented, was that there were numerous bags of trash, household trash, that were unsecured. There were a number of cushions and mattresses and things like that that can certainly become harborage for, you know, any type of vermin. So those things were cleaned up to my satisfaction. I told him so. I spoke with the person that filed the complaint today, explained to her that I was satisfied with the cleanup that had been done, and so she's okay. I did tell her that if she finds that things are reverting back to what they were before, then we'll react again. So
Okay.
for the time being, that's put to rest. Okay.
Very good.
Thank you.
Update on Silver Street. That is something that is right now is being handled by the building commissioner. It is a zoning violation due to the number of unregistered vehicles that he has on the property. He has made a fairly consistent effort in trying to get the person that owns the property and owns the vehicles to just come into town hall and speak to him and try to get the problem resolved. He has not had any success. So his next step is to try to involve town council, whether it be to have town council prepare a demand letter, for lack of saying it a different way, and having that delivered via the sheriff's office. Sometimes that's the only way that things move to some form of resolve.
Yeah.
So that's all I have on that. Item number 3 on here is an update on the meeting that we had on March 12th regarding the North Carver landfill, and more specifically the homes that are being provided bottled water and the homes that are part of a testing protocol for the landfill. As we've talked about before, the contaminant of concern is called 1,4-dioxane, and at that meeting, which was attended by our chairman Arthur Borden and member Eric Mueller, as you recall, there was a presentation made by Bruce Haskell of Langdon Environmental and Luke Fabry, who works in tandem with Langdon Environmental. Luke Fabry is a licensed site professional, and his company is Geological Services Incorporated. In essence, what they did was they gave a brief history of the landfill, when it closed down, when the initial thrust to clean up the contaminants took place, how that was done. It was done through an extraction system, or plant, if you will, that took the water out from the landfill. In other words, as the water was moving through the landfill and heading in a northerly direction, this plant would extract the water and treat it. So they made that presentation. They also presented that we're going forward with extending the water line. And that water line has a potential to have 2 phases. One would be to run the water line up Plymouth Street, and serve those people that are currently under that testing protocol. But there's a likelihood that we would be extending that water line up the two side streets, namely Hines Avenue and Captain Perkins Drive. So that being said, the other thing that was presented at that informational meeting was that in the next round of testing, they're going to include all of the homes along Captain Perkins Drive and Hines Ave, and that's going to give them more data to determine the need for that extension up those streets. So all in all, I felt that the meeting went very well. I think that Bruce and Luke did a very good job at explaining things. In many instances, they were very technical answers that needed to be given, but they did it in a way that I thought that they made it very understandable. And I can say that I was told that social media had very little comment after the meeting, which I think is always a good sign. Generally speaking, social media can be, well, somewhat negative, if you will, and that's what you see a lot. So I guess what I'm trying to say is that, you know, it's a testament to what they were able to present and allow people to understand. But I think the most important thing that came out of that is that I think people are seeing that there's an end in sight to all of this. When you extend that water line up the street and start serving those people, then the testing protocol goes away, and you know, it's almost something that would only need to be monitored in a lesser fashion. So that was how that meeting came out.
Could I just ask on that note, I know we have a contract now for the design of that extension. Do we have a ballpark as to when the plans will be ready for permitting?
I do. In fact, one of the requirements of the proposal that they were submitting was to give a timeline. So if you look at all of the individual tasks, I believe that they were going to be able to complete their task within about a 3 to 4 month period from the time that we gave them the go-ahead. So that would include, all of the field work to determine existing conditions. It's going to include the filing with Conservation Commission for the work that's going to be done in and around Muddy Brook. So, you know, between the design, the field work, the permitting, I think, 4 months is a reasonable period of time. Number 4 on the agenda, there's nothing to provide. I sent that revised nuisance regulation that we've been working on to town council to have him review it. Unfortunately, he has not but given what we're all dealing with, it's certainly understandable. They're working with a lot of towns now, trying to give advice, legal advice as to, things like town meetings and public hearings like this, and what has to be done and what can be done, what can't be done. So I'm hopeful that they'll have something for us at our next meeting. But I think this is certainly a back burner issue at this point. I'm not going to be spending a lot of time on it. King Richard's Fair, I should have made copies of this, but if you recall, they had submitted a request that they be allowed to replace their trailer units with porta-john units. Their point was that the trailer units are in essence obsolete. They're requiring much too much maintenance. They're subject to, failing, during the most inopportune times during their fair.
Yeah.
So as a result of that meeting, or that request at our last meeting, we had asked for them to provide us with some information as to how many units are you going to have, and we also wanted to have a signed contract from a licensed septic hauler. So it's a fairly brief letter, so if you don't mind just taking a quick peek at that. And I'll also send along the 2 tables that you sent me. Their letter also indicates their hand washing facilities that they have there. They mentioned in their letter that they have I believe that letter said that they have a staff member that's there
Right.
throughout the course of the fair opening.
Were they able to supply a rough head count number on each day? I know weather is a factor with,
Yeah.
and, last year we had the Triple E situation, so I know the numbers were down, but if they had an overall idea of persons per day, because I know that plays in a part to the number of units that they want to
Oh, yeah.
have in there.
All right, well, what I could do is, I can get a number from them, and it should be the highest number
Correct.
that they would anticipate, and then I could just reference the table and determine whether or not their number of 20 to 24 is sufficient. If
Right.
it's not, and then we would,
Right.
if everything else is in line with what the board was concerned about, then I could take that number, utilize the table, and then if it says that, no, based on that number, you should have 30 porta-johns. If everything else is in line and in order, then they would just be subject to that number. Now, as you increase the number, you may have to increase the number of handicap units as well.
Correct.
Right.
And I know it seems like it's a long ways away, but they need to do, they're planning well in advance.
Right.
So if I can get back to them.
Okay. Thank you.
Would that be okay?
You want us to do a formal vote and authorize you to,
Sure.
okay. I'll entertain a motion to allow our agent to review the proposal from King Richard's Fair for replacing the porta-johns, installing porta-johns to replace the trailers that are currently there now, and to authorize them to provide the required number of units.
Motion seconded.
Any further discussion?
Good.
All those in favor, aye?
Aye.
Aye.
Very good.
Okay. Now, I don't know who wanted to put Triple E on this.
Well, I know nobody wants to hear about it, but
Here it
it's
is.
not that many months away, unfortunately.
know.
And Kevin and I attended a meeting not too long ago with Plymouth County Mosquito. They kind of talked about this upcoming season, and this is the second year of the 3-year cycle, and it's anticipated that this will be worse than last year.
Mild winter. So,
It's just, it really, it's just the cycle itself.
Yeah.
It starts, it peaks, and then the third year it'll go back down more like last year was. And then it'll disappear for 6 or 7 years. I wanted to bring it up we put it on people's radar.
Yeah.
I know there was concern last year that we surprised the schools and recreation department. Couldn't have done anything different about it.
Right.
It escalated so quickly. I mean, within 6 weeks of being branded moderate, we were already at dead red. So I just wanted to put people on notice that from the protocol that I've been told, that we will not be starting, when this starts this year, we will not be labeled moderate. We will be automatically labeled high risk because of where we left off last year. That being the case, and what the other you two feel like, but last year we started out allowing for the spray to play when we were at moderate.
Yeah.
When we went to high risk, we eliminated that feature. I think it's only fair to let the schools know and the rec department know that that's probably going to be the case this year, that there will not be a spray to play potential. It'll be just you don't do it. And that now is really the time to be thinking about their scheduling.
Right.
So once again, they're not, cut off, just stuck on.
Yeah, well, it was a mad scramble last year.
Yeah.
So
Yeah.
if they're aware that this is quite possibly more than that, it's going to happen, and you should start planning accordingly. What I could do is I could prepare that letter and ask the board to sign that letter at our next meeting.
Okay.
Or, if need be, we're really not that far from, the warmer weather and the mosquitoes to be out there. So maybe what should be done is, rather than waiting till the next meeting, I can prepare the letter and then have you review it and individually sign it, here at the town hall. I think the sooner it gets out, the better for everybody, for them as well.
Yeah, they can
More so.
adjust schedules, stay away from that dawn and dusk area.
Yeah.
Yeah.
Kind of group everything in the middle there, and
Yeah.
that'll help, especially when the fall rolls around.
Right.
Okay.
Did anything come from that meeting about preemptive measures prior to mosquito season that Plymouth County can do, or if the state's going to get involved with anything, or no?
They did talk about some aerial spraying that they could do ahead of time. I got the impression, I don't know whether Kevin has the same feeling, I think, though, that before they can do too much, they have to have, there's a complex layer of bureaucracy. DPH is involved, conservation people are involved, and unfortunately, Plymouth County is not at the top of that food chain. They're a ways down the food chain before they can really do something.
Yeah.
They did talk about being able to get in and larvicide the hot spots that they're aware of,
Yeah,
but again.
remote areas is what
Remote
we're
areas,
talking
right,
about.
right. So,
The areas that they can't get to with a truck.
Right.
Yeah.
And they do have new equipment that has a larger spray radius.
Right.
Well, yeah, spray
it's a
radius.
spray
is
radius,
what
yeah.
they call it.
yeah,
But as Arthur was just saying, that they can't just unilaterally make a decision that they're going to go out and, spray. It has to go through a proper chain of command, and
Yeah.
sometimes it's rather slow.
So communication has to happen pretty quick.
Yeah.
From
And
Plymouth County.
the parties don't all necessarily agree with one another.
Right.
Whether it's an emergency or what needs to be sprayed or what doesn't need to be sprayed, so, yeah, it's a process.
No, that's all I have.
Moving on to the minutes of February 18th.
Thank you.
On page 2, about towards the end, the letter that King Richard's Fair just sent us had the last page had a great scale of how many handicapped accessible porta-johns are needed. I'm not sure what is in here is the same as what's on that letter. So it says 1 for every 10, and I looked like there was something different on the letter that King Richard's Fair sent. On the last page, it had this scale of,
Yeah.
So I'm not sure the
Well,
statement is accurate.
Those two tables are actually something that Eric had given to me.
Okay,
So what I'm doing is I'm going to be getting a number from them that is their maximum capacity.
okay,
Based upon that maximum capacity number, I'll then enter the table and determine whether or not the number that they've got on that letter.
great, thank you.
Between-
Thanks for explaining that.
So
Okay.
it may end up being that their number is right on cue, or
Okay.
it may be that they need more than what they've got.
Okay, thanks for that. That was a great table.
Yeah, that helps. Yep.
Other than that, no issues.
Make a motion to accept the minutes for February 18th, 2020.
Motion seconded.
Motion's been made and seconded to accept the meeting minutes as presented from February 18, 2020. Any further discussion? All those in favor, aye.
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 correspondence of any kind? No? Okay.
Meeting date.
April 21st. 5 PM? Yeah, next meeting.
All right, our next scheduled meeting date will be April 21st at 5 PM. And before we adjourn, I'd just like to remind people, please follow the advice of our state DPH, the CDC, our local officials and safety people. We can get through this, but we have to work together, and we have to limit our contact with people and be safe. So,
Yep.
Yes.
Thanks for arranging this room tonight to model that.
Okay,
Yeah,
Appreciate that.
thank you.
all right.
Anything else?
move to adjourn.
Yeah, make a motion to adjourn?
Motion seconded?
Any further discussion? All those in favor? Aye.
Aye.
Thank you.
Thank you.
Okay.
Thank you.